Hello everyone, this is Dr. Ryan, creator of Boards and Beyond. Welcome to my office here in Connecticut where it's snowing outside. And in this video, I'm going to go through a step one style question that was sent to me by one of my Twitter followers. So let's get started. So here's the question. A 14-year-old girl presents for routine evaluation. Vital signs are normal. Cardiac exam identifies a murmur loudest at the left upper sternal border. Phonocardiogram is shown below. And the question asks, the patient's murmur is most likely due to which of the following mechanisms? Abnormal narrowing of the aortic valve, incomplete ventricular septum development, increased blood flow to lungs, or regurgitation of blood from the aorta. So first of all, let me just say before I even explain this question to you that this question is ridiculous. I know there are lots of questions like this on QBanks and MBME exams, but this is showing an image of a phonocardiogram. This is something that hasn't been used in medicine for over 50 years. Before we had echocardiography, doctors would sometimes tape record the sounds in the heart and depict them on a graph like this to try and identify murmurs and different heart sound findings. We never do this anymore. Phonocardiography is not taught to medical students. So this question by design is meant to be super tricky. This really isn't a question about medicine. It's more like a Rubik's Cube to say, can you solve this little puzzle and figure out what we are asking? So I feel very badly for all of you that you have to answer questions like this, and do not beat up on yourself if you struggle with this question. You can go on to be an exceptional doctor, even if you have no idea what this question is all about. So having said all that, let's look closely at the question. So it's a 14-year-old girl who comes in for routine evaluation, and she has a murmur at the left upper sternal border, and she also has these findings on phonocardiogram. Now, luckily, they're nice enough to label the phonocardiogram for you. Thank God for that. So in a phonocardiogram, the sounds make these lines that go up and down like this. And so here they've shown you S1 right here. S1 is the first heart sound. It has two components, but they're usually fused together. And you can see that here. There's a line here and a line here, but they're very close together. Those are the two components of S1. Then the second heart sound has two components, A2 and P2, and during parts of the respiratory cycle, they're often separated by time. And you can see that here. The A2 component comes first, followed by the P2 component, but they're separated by a little bit of time. In other words, they're separated in space on this image. So what they're showing you is the first heart sound here and the second heart sound here, which has two components. And then between these two heart sounds, there's a systolic murmur. That's all this junk here in the middle. So they're showing you the two heart sounds and the murmur depicted on a phonocardiogram. Now, if you look, during expiration, the A2 and P2 are separated in space. There's some white between them. During inspiration, they do not come together. They're still separated in space. And then again, during expiration, they remain separated in space. So what this image is depicting is a fixed split S2. And you've all probably heard of that before, but you've never been asked to identify it on a phonocardiogram. And that's what makes this question so hard. Honestly, if this question were on the cardiology board exams, probably 75% of test takers would get it wrong, because this is extremely difficult to interpret this kind of image if you've never had practice before. But anyway, now that you know that it's showing a fixed split S2, hopefully you know that that finding is associated with an atrial septal defect. So they're telling you that this 14-year-old girl has an atrial septal defect. And associated with that defect, she has a murmur at the left upper sternal border. And they're asking if you know the murmur that usually goes together with an atrial septal defect. Now let's imagine that we have the right atrium and we have the left atrium, and there's a wall between these two chambers, but in a person with an ASD, there's a space in that wall. That's the defect. Because of this space, blood will flow from the left atrium into the right atrium and overload the right atrium with volume. That will lead to more blood flow through the right side of the heart, from the right atrium down into the right ventricle and then out into the lungs. So patients who have an ASD usually have increased blood flow through the right side of the heart, and that often creates a flow murmur from that extra blood flow. And so if we go back to the question, it says the patient's murmur is likely due to which of the following mechanisms, and the answer is going to be increased blood flow to the lungs. This is the type of murmur that is usually associated with an atrial septal defect. Most of you probably know that ASDs are associated with a fixed split, and you may know that they're associated with this murmur, but you probably have a lot of trouble recognizing it on a phonocardiogram. Now, let's look at the other answer choices. So answer choice A is abnormal narrowing of the aortic valve. That describes aortic stenosis, which is a condition mostly of elderly people. It's a wear and tear lesion on the aortic valve. There's no reason to expect it in a 14-year-old girl presenting for routine evaluation. Answer choice B says incomplete ventricular septum development. That's describing a VSD. Now, a VSD does cause a systolic murmur, just like we've got here, but it causes a holosystolic murmur. Holosystolic murmurs have the same loudness throughout systole, but notice that this murmur gets quieter as systole goes along. That's what happens with flow murmurs. They get quieter as time goes along. In a VSD, you have a holosystolic murmur. So this can't be a VSD, and in addition, there's no special reason why patients who have an ASD would also have a VSD. It's much more likely for an ASD patient to have a murmur from simple increased blood flow to the lungs than to think that they might have a second congenital heart defect of a VSD. And then finally, answer choice D is regurgitation of blood from the aorta. This is describing aortic regurgitation. That is a diastolic murmur. That would occur in this space here, which is diastole, the space between S2 and S1 right here. So because this patient has a systolic murmur, they cannot have aortic regurgitation as the cause of their murmur. And once again, there's no special reason why an ASD and aortic regurgitation would occur together in a young person either. So that's another reason why answer choice D is not correct. Now, even though this question is super difficult and super tricky because of the phonocardiogram, I just want to point out that the information it's testing, the basic information on heart sounds and ASDs, is actually something you should know. You can find it in First Aid for the boards. So here's the page in First Aid describing splitting of S2. It describes fixed splitting, and you can see that that's heard in an ASD. It also tells you here that there's left to right shunting like I described, which leads to increased RA and RV volumes and increased flow through the pulmonic valve, which was the answer to the question. So all that basic information is right here in First Aid. Here's the page in First Aid about where murmurs are heard. This is the left upper sternal border like was described in the question. That's the pulmonic area, and this is where you can hear systolic ejection murmurs from pulmonic stenosis. It's also where you can hear the flow murmur of an atrial septal defect, and you can see that shown right there in First Aid for the boards. So even if you had no idea what that question was asking, if you just knew that flow murmurs are common in the left upper sternal border, you might have been able to get the answer to that question correct. And then finally, here's the section from the congenital heart disease portion of First Aid describing atrial septal defects. They cause a wide fixed split S2 as shown right here. So if you ask me what the takeaways are from this question, first of all, the first takeaway is that it's a ridiculous question. It's super hard. Don't feel bad about yourself if you struggle to answer it. The second takeaway is don't worry too much about the phonocardiogram. That's extremely difficult to interpret. I don't think you'll ever see anything like that on your boards. I didn't even see questions like that on the cardiology boards. But then the third takeaway is you should make sure you know basic information about atrial septal defects. That's really what this question is testing. You should know that they cause a fixed split S2. You should know that they're associated with a flow murmur from increased blood flow to the lungs. And if you know those two things about ASDs, then that, in my opinion, is the real takeaway from this question, nothing more. By knowing that information, you'll be able to get lots of board questions right. And that concludes our video today on how to answer a Step 1 board question.